While conducting a training on the disease at the Biomedicus International Laboratories, Dr. Joreva, a specialist in blood marrow transplant, highlighted the need to initiate treatment programs in the country. This increased attention is geared to reducing sickle cell-related deaths while increasing care and management outcomes.
Other things which were very high on agenda were how to streamline the pre and post transplant care services, because after the patient has come back for transplant, we can't just leave them, okay, because the job is just half done. All right, so how to streamline those processes, those investigations, that clinical assessment.
Before, Ugandans said to seek medical treatments abroad. Government officials say efforts are in place to address the disease burden by introducing care centers in the country.
It has worked to identify proper care centers, starting with the Mulago National Referral Hospital, that has been running probably the largest and oldest sickle cell care program. But the ministry has also helped in setup of other satellite sickle cell care programs.
However, with the treatment being expensive, only a few people can afford it, thereby leaving the majority unable to get treatment for the disease.
Of course, most people who go are able to afford. It's very expensive to do a bone marrow transplant. It can even cost as much as 300 million to do a bone marrow. So it's only those who are able. That means only those who are able to get this bone marrow transplant. But also we know people tend to go late.
The government calls upon people diagnosed with sickle cell disease to seek medical treatment early, adding that people below 13 years stand a higher chance of recovery.
Those people who have a high risk for complications, we need to pick them very early, and we prioritize them for this kind of technology. But also there are new technologies coming, and we are working at the JCRC, with government, with the JCRC, because you can do a bone marrow transplant where you put a new material in your body.
It's less than 13 years. Nowadays we say that the sooner we recognize that yes, any child who's suffering from sickle cell disease and is having quite significant complications, the sooner we consider that patient up for transplant, the better it is.
With the establishment of a number of sickle cell disease treatment centers in the country, this is a major step towards eliminating the disease in Uganda. Absolom Wangoru for CTV PM Edition.